Hi, my name is Heather Barraclough. I'm here with Herzing University, and today I'm going to be doing a neurological exam with Doria, my neighbor. So let's get started. First of all, we're going to go over our cranial nerves 1 through 12, and our first cranial nerve is the olfactory nerve. So I'm going to have Doria take a smell of this candle and let me know what it is. Vanilla. Okay, our second cranial nerve is the optic nerve. And the optic nerve is responsible for visual acuity. So I am going to have Doria hold a 3x5 card in front of her left eye as I cover my right eye. And I'm going to be checking for peripheral vision. So tell me how many fingers I have. 3. And here? 2. How about here? And here? 2. Perfect. Okay, the next thing we're going to test for is visual acuity on the Snellen chart. So this is the chart we're going to be using for the test. Okay, Doria, I would like you to read which letters you're able to read on the Snellen chart that are smallest. And if you have glasses, please put them on. Okay? I want you to first look at it with both eyes. Then I'm going to have you cover your right eye and then your left eye. Okay. So here we go. E, P, T, Z, O. And now cover your right eye. E, F, T, Z, O. And cover your right eye. E, P, T, Z, O. Okay, excellent. So Doria was able to read the line that says 2025. So that means that at 20 feet, she is able to read that line, whereas a normal person with eye would be able to see that at 25 feet. Excuse me. Okay, so our next cranial nerves are the oculomotor, the trochlear nerve, and the abducens. So here we're going to test for the 6 cardinal fields of gaze, and I'm going to look for the pupils to be equal and reactive to accommodation, and I'm going to check the light response on the pupils as well. Okay, so Doria, if you'll kindly sit over here, I'm going to check your pupils. Okay, and her pupils are constricting to the light, and I'll try this one. Excellent, her pupils are constricting to the light. Okay, now I want you to just hold your head still and follow this instrument with your. That's the 6 cardinal fields of gaze. Okay, and the next thing I'm going to double check for involuntary shaking movement of her eye or tremors in the eye area. Okay, so our next cranial nerve is cranial nerve number 5, and that one is the trigeminal nerve. So I'm going to be checking, have you clench your teeth real tight, and I'm going to be checking your trigeminal muscle, and then your temporal muscles here. Okay? And excellent. So that's cranial nerve number 5, and cranial nerve, the next one is the facial nerve. So if you can please puff out your cheeks. Okay, lift up your eyebrows. Frown. Smile. Very good. So that's the facial nerve. The next nerve we're going to demonstrate is the vestibulocochlear nerve, and that is a whispering test I'm going to perform with Doria. So I'm going to cover your right ear, and I'm going to whisper over here to your left side. Tell me what I'm saying. 89. Okay, and I'm going to whisper, cover your left ear and whisper over here to your left side. All right. Excellent. All right, our next cranial nerve is cranial nerve number 9. That's the glossopharyngeal nerve. And I have a tongue plate here, and I'm going to check to see if Doria's, I'm going to pretend that I'm tickling the back of your throat to check for your gag reflex. And we know Doria has a gag reflex. So, hold on one second there. Okay, so we know Doria has a gag reflex. So we are going to move forward with this video, and we're going to go to cranial nerve number 10. Cranial nerve number 10 is the vagus nerve, and it's responsible for talking and swallowing. So I know that Doria is able to talk, and she's able to swallow, so we are going to move on to cranial nerve number 11. Move your head up, and bring your head back down. Okay, and now I'm going to test for shoulder shrug. I'm going to put my hands on your shoulders, and I want you to push up against my hands. Very good. Okay, our last cranial nerve is cranial nerve number 12, and that's the hypoglossal nerve. And with that nerve, we're going to test for tongue movement. And I'm going to have Doria stick out her tongue and move her tongue from side to side. Okay, so the next thing we are going to do in this video is the superficial and deep tension reflexes. I'm going to be checking for the abdominal reflex. Also, I'm going to be checking for the biceps, the triceps, the brachioradialis, the plantar reflex, and ankyloclonus. Okay, here we go. All right. So Doria has her shirt lifted up a little bit, and I have my cue. So that is your abdominal reflex. The next one that I'm going to check is for your brachioradialis. So if you put your arm straight out for me. Okay, and I see where her radial artery is. I'm going to go 3 centimeters above there and snap it with my hammer and check her reflex. She's got a good reflex. All right. Now make a muscle with your arm. Okay, and I'm going to feel for the tendon in the bicep area, and then I'm going to tap that area. Have Doria hold her arm up, and I'm going to have her rest her arm up against my hand. Okay, and with that, I'm going to go above her elbow about 0.5 centimeter, maybe 1 centimeter, and I'm going to tap my hammer to check for the tricep reflex. The next reflex we're going to check for is her patellar. Since she's already sitting here, although not required, I'm going to have you sit here, dangle your legs, and right below her kneecap, I'm tapping with my hammer, and I'm going to be checking her ankle since I'm already down here, and I'm going to hold her foot and check for the back of her ankle and see whether or not her foot comes down and she dorsiflexes a little bit. Okay, 1, 2, 3, I'm going to tap that, and her foot came down, and she's good. The other thing I'm going to check for is the Babinski reflex. So I'm going to take one of the cotton Q-tip swabs, the bottom of it, and I'm going to make a lateral upside down J at the bottom of her foot. And if the toes curl in and she dorsiflexes a little bit, that's normal. Although with children that are 24 months and less, fanning out of the toes is totally normal. Okay, so now that we've done our reflexes, we're going to check for cerebellar and sensation. So with that, I'm going to have you stand up here alongside of the chair, and I'm going to check for your stance. And she has her arms to her side, and I'm going to touch her back a little bit, and her balance is maintained. So she looks great. All right, now, Doria, I'd like you to walk across the room, and then back on your heels, and then walk across with one foot in front of the other, and then back with your toes. Okay, now we're going to check for, if you take a seat here, we're going to check for proprioception. I'd like you to close your eyes, and I want you to tell me on your fingers or your toes whether or not you feel your fingers go up or down, or your toes go up or down. Okay, here you go. And your toe. And we'll check the other side. And your toe. Very good. So the other thing, we're going to have you touch your nose and put your arm out to the side and try to do that quickly. Also, I'm going to have my finger here and touch your nose to my finger, and try to do that at least 4 or 5 times as quickly as you can. All right, we're also going to check for rapid movements of your hands on your lap, and I want you to go across like this, back and forth on your lap, and let me see how quickly your movements are, and I'm checking for any kind of abnormalities or change in right side from the left. Okay, so she's doing that. What I'm going to check for is stereognosis and breathesthesia. So, Doria, I'm going to have you close your eyes, and I'm going to place an object in your hand, and I want you to tell me what it is. Okay, so here you go. Paperclip, she got it. All right, no, great, and so she's got that. Now, one more object here. I'm going to close your eyes, Doria. I'm going to place this in Doria's hand. Okay, so here you go. Tell me what it is. Perfect. All right, now I'm going to check breathesthesia. So I'm going to draw a number or shape in your hand, and I want you to tell me what it is exactly. So close your eyes, and I'm going to draw on your hand. Now we're going to check for sensation. And with sensation, I have my Q-tip swabs. I'm going to break one in half, and I'm going to use one as the soft one as the dull, and then I have a paper clip here, and I'm going to use one edge as the sharp edge. And we're going to test this on you first before we do anything, so you know which is sharp, dull, or soft. And with your eyes closed, I want you to tell me which part of the body I'm touching and whether or not it's soft, dull, or sharp. And also whether or not you have the same feeling on the right side as well as the left. Sharp, dull, soft, sharp, dull, soft, sharp, dull, soft. Okay, so you got that right. Now, I'm going to touch your right side here and your left side. You can open your eyes, but I'm going to ask you now, do you feel the same sensation that you're feeling on the right side that you do as on the left? You do. Okay, and how about in your lower extremities? Perfect. Now, we're going to pretend that my ophthalmoscope is a tuning fork because I wasn't able to get a tuning fork, and I'm going to check for vibration in her head. To see if she feels the tuning fork on her head. And then I'm going to check for a vibration on your great toe. Do you feel that? Yeah? Okay, perfect. With discrimination. Okay, that concludes the neurological exam for Herzing University, and thank you for listening